It's called Cosmetic Gynecology 2022, The War. Now, the war is not that war, okay? The war that I am talking about has been raging for 2 decades. It's the war between the academics and the cosmetic gynecologists. It's the war over the vagina and the vulva, who controls it, and who gets to make the rules about working on it. So, being the good warrior, I'm going to load you up with a few of my favorite weapons for fighting the good fight. I'm going to expose their weaknesses. We're going to exploit them. And I'm going to show you how to take the high ground, the moral high ground, away from them. You are a gynecologist. And today you have 2 new patients scheduled for routine examinations. Say hello to Chloe. She is your first patient. Chloe likes to chat while you do your routine GYN exam. She says she has a big nose and she wants it smaller. She doesn't like the way it looks. In addition, she says it's uncomfortable when she uses masks for scuba diving, airplane travel, and certain types of sex. You are not trained, educated, or experienced in making noses smaller, and you know it. So you triage the entire issue to an expert in making noses smaller. You do not take on a paternal role because she is not your daughter. You do not inject your personal opinion because she did not ask for it, and she is not your friend. You do not stand in the way even if you disagree with her opinion. Well, let's move on to your second patient. You have a busy day. Say hello to Zoe, Chloe's twin sister. She also likes to chat as you do your routine examination. She says she has a big labia minora. She doesn't like the way they look, and she wants them smaller. In addition, she says that they are uncomfortable with certain activities, tight clothing, and sex. You are not trained, educated, or experienced in making labia minora smaller. But you push them out of the way every day when you do your speculum exams. And because of that, you think that you are the gatekeeper and the keymaster of the labia minora. And anything and everything that a woman contemplates doing with that area must meet with your approval. And if it does not, you are not going to send her to an expert in making the labia minora smaller. You are going to take on a paternal role, even though she is not your daughter. You are going to inject your personal opinion, even though she never asked for it, and she is not your friend. And if you disagree with her opinion, you are going to stand in her way. Let it sink in. She is not your daughter. She is not your friend. And she did not ask for your opinion. You are not an expert in these procedures, and your opinion is not an expert opinion. Worse, you might think that labiaplasty is easy to do and attempt to do it despite your lack of training, education, or experience, because you think that all you have to do is pull hard and then clamp cut and suture. And in your ignorance and in your arrogance, you are going to mutilate Zoe You are going to destroy delicate nerves that you did not even know existed. You are going to cause misery and suffering. Sadly, you and your like-minded colleagues are going to portray this mutilation as evidence that aesthetic genital procedures are fraught with danger. Let this sink in. Cosmetic gynecology requires training, education, and experience. And it takes time, and it's not easy to do. You didn't attempt the labiaplasty. Good for you. But she didn't get one either. And it had nothing to do with it. You told her this. This was the sage advice that was given to you by your academic society. Ironically, nobody in your society knows anything about cosmetic gynecology. She didn't get the labiaplasty. She got pregnant. It's 9 months later, and you just delivered her baby. And that baby is a boy. And she wants that boy circumcised. And you are going to do this. No, you are not going to do this or say anything like this. You are going to take that foreskin and you are going to cut it off like you have been doing for your entire career. Now, take a look in the mirror and accept the truth. You have a double standard, and you have a bias. Let's talk about this. Who needs reassurance? Does Chloe need reassurance that her big nose is normal? Does Zoe need reassurance that her big labia are normal? Chloe knows that her big nose is normal. She just doesn't like it. Zoe knows that her big labia are normal. She just doesn't like them. And she knows that they can be made smaller. So that's what she wants to do. What does normal actually mean? Normal means similar to most. But when we reassure the patient that she's normal, we're using a different definition of normal. The definition that we're using is free of defects. And that is not the same thing. When your mammogram and your blood work are free of defects, you are happy because it means nothing negative is going on with your body. Nothing unwanted is going to complicate your life. Normal is your endpoint. When you tell an aesthetic patient that everything is free of defects and in the normal range, you are not providing any reassurance at all. She is unhappy with her place within the normal range. She wants to be in her personal, ideal sweet spot within that range. She wants to be taken from her negative emotional baseline to a happier place. The fact that it's normal anatomy is a given. This is the essence of aesthetics. She wants to be in her personal, ideal sweet spot. The fact that it's normal is a given. It's not a sign of madness. Dysmorphia is the exception. It is not the rule. You have to screen for it, but you don't have to treat sane adult women as if they are insane. Once you accept this, then the only thing you can decide is whether you are comfortable engaging with aesthetic procedures or not. Let this sink in. Aesthetic procedures are done exclusively on normal anatomy. You already operate on normal anatomy every time you do a tubal ligation. Take out a normal cervix, a normal tube, a normal ovary, a normal appendix, and an unwanted normal pregnancy. Look in the mirror again. So, why is appearance so important? Appearance has value, and desirable appearance, regardless of your orientation, has reproductive value. We are the products of cavemen and cave women of all shapes, sizes, and features, mating randomly for 1/4 million years. Those that produced the most offspring had the shapes, the sizes, and the qualities of reproductive success. Naturally, an affinity for these features was passed on and baked into their offspring and their descendants, who are sitting in this room today. If you had an affinity for things crooked in the Stone Age, good luck passing those genes on when there's nobody around to deliver your baby with a cesarean through your crooked pelvis. And so on and so forth. And when you feel that you have been moved by any means to your personal, you feel happy. You feel confident. You socialize better. And fair or not, sometimes the world treats you better. Yet here we are today, 1/4 million years later, denying our nature and pointing fingers at the media, the internet, and the porno people. So you can blame the caveman and the cavewoman for giving you an affinity for smoothness, symmetry, and youth. It's our nature, and you cannot win a war against nature. And the only opinion that matters is the patient's opinion. Nobody tells you what to wear, how to dress, what to pierce, what to ink, how to cut your hair. So embrace the fact that your non-expert opinion is irrelevant. When you take all of the criticisms that have been made about cosmetic gynecology, the only thing that you conclude is that some people don't like the concept and will go out of their way to offer negative commentary despite any actual knowledge or experience on the topic. From what I have seen over my entire career, academia despises any advance that comes from outside of their control. Remember how they hated laparoscopy 30 years ago? For every rationale that has been given for not performing a cosmetic GYN operation, there is an operation in mainstream academic practice that breaks that rationale. I hope I have enlightened you and equipped you to fight the good battles and win the wars with these lessons that I have learned. Open their eyes, open their ears, open their minds. There is a world of women looking to be moved to their ideal range. May these lessons serve you well, and namaste. Thank you. Thank you.